However, we are seeing a lot of hesitancy from parents for even that age group. Doctor, I'd like to know how you think COVID-19 is affecting those people between the ages of 12 and 17. And, what do you say to people that are still hesitant to get that group of children vaccinated?
Well, what's happened, I think, is there is a lot of information that comes out on the media, a lot of information that gets transmitted from person to person, which may not have scientific validity. So parents get scared and they try to sort of shy away from these vaccines. Many of us have that fear that since these vaccines were approved under the emergency use, that they weren't tested enough, that we really don't know what the side effects of the vaccines are going to be, or what the long-term negative impact of the vaccine is going to be. And then we started to hear about possible side effects of the vaccines. Then lately what we've been hearing about is the effects around the heart, the myocarditis with the vaccine, and all of these pieces of information that we as parents get tends to scare us. And that is where I think the hesitancy is coming in. But what we have to look at is the overall picture, what has happened since the vaccines came out. We know about a year ago when the pandemic had hit, the way people were dying, what was happening in terms of healthcare. And as the adults started to get vaccinated, we saw the transmissions rates going down, we saw the severity of the disease going down, and definitely a much society than before the vaccine came in. Once the vaccine then was approved for the adolescents, people said, well, it wasn't studied enough, there really wasn't enough rigorous activity that was done to approve this vaccine, and people just, the government wanted to just go ahead and approve the vaccine. But when we look at that, the side effect profile that we have seen is pretty much what we have seen in adults. So when millions and millions of doses have been given to adults, the side effects that we've seen are minimalistic, and the protection from the vaccine has been much more.
Doctor,
so the hesitancy that's coming in, right, I think needs to be looked at very carefully with the parents.
Definitely. When you're looking at just that age group, because I have questions for other age groups as well, the 12 to 17 age group, do you think it has any developmental effect on their body after they get this vaccine?
To date, we have no indication of that. So the fear that something is going to happen long term pretty much is unfounded at this point. So at this point, we don't have any scientific evidence that there is any long-term impact on the vaccine. Do
you see Moderna get approved for this age group soon as well?
That is up to the vaccine approval authorities. At this point, we hope that it will get approved so that we have more vaccine for the adolescents that can be given.
And doctor, will it have the same effect as the Pfizer vaccine in terms of, the side effects you get after that?
Once again, we don't know the answer to that, but the side effect profile has been very similar in adults and between the Pfizer and the Moderna. So we're assuming that will be the similar side effect profile that we see in adolescents.
Yes, and let's hope that this happens soon. Now I have questions about the age group of 2 to 11. Currently, I believe both the vaccines, Moderna and Pfizer, are doing these clinical trials, and they're saying that they will have some results in September perhaps. I would like some insight into what is happening in these clinical trials, whatever you have heard. And, we're also hearing that they may have a lower dose of the COVID-19 vaccine being administered to them, that age group. Why is that?
So we're still in the process of studying the vaccines. We are in the process of clinical trials. So what happens in clinical trials, for people who may not know the terminology, is a group of kids in that age group will get the real vaccine, and a similar group will get what's called placebo. So it might just be some salt water or some sterile water that gets injected into the child. And then they look at the effect of the vaccine as compared to the placebo. And if we see an effect that comes in with the vaccine and the side effect profile is very low, then that is where the vaccine gets deemed effective and gets approved for that age group. So when we're looking at the age group between 2 and 11, or even younger, we are using that age group as our, and many people might say, guinea pigs, but really those are the kids that are getting the vaccine, and we are now looking at the efficacy of that vaccine. And when these studies were done in the older age group between 12 and 18, a lot of what we studied was in that age group, and we saw that the vaccine was almost 100% effective. And that is where the emergency use approval came in for adolescents as well.
Right. What about 6 months to 2 years? I'm reading here that it could be available in October or November. That's a very crucial age of development for a lot of children. Will that also have a lower dose? How do you see that going?
Once again, we don't know. So if you look at, maybe the flu vaccine, which is something that a lot of people are aware of,
right.
And that vaccine is given at 6 months of age and above, and it's a seasonal vaccine. It's given every year. Initially, when that vaccine was being given up to a few years ago, was being used at a lower dose than it was for adults, and it was believed that the lower dose needed to be given incrementally to get the same sort of effect in babies as opposed to adults. That may be the same model that's taken with the Pfizer or Moderna vaccine if it gets approved at that time, but at this point, it's still too early for us to figure out or to say that the vaccine is going to have a lower dose.
Right. So now it brings me to my million-dollar question, doctor, which is the schools reopening. Across the country, a lot of schools are going to be in person only starting the fall. Now, my question is a two-part question. The first is 12 to 17 that are already getting vaccinated. Do you think schools should have a requirement of the vaccination card and then require other unvaccinated children to wear a mask? How should that go in that age group? And my second question is the 2 to 11 will not be vaccinated in the fall because the clinical trial results will be coming in later in September. What should be done with that age group? Should they be wearing masks, social distancing? How are you looking at this whole scenario? It's very confusing.
Right, and I think it's very scary. It's not just confusing. I think a lot of our parents are at a loss as to what they need to do, what they should do. Most of them want their kids to go back to school. Most of them want their kids to be able to socialize and be back to the normal stage as much as they possibly can. But that fear of COVID, the fear of not having their child be vaccinated, is a real fear for most parents. What we do know from the natural course of the pandemic is that when kids do get COVID, they really shake it off very easily. There is a small portion of kids that have, a very small number that has died. There's been a small number of kids that have developed MIS-C. So complications can happen, but the majority of the kids that we have seen, and even in China where the virus originated, we all of the studies showed that the complication rate was less than 2% in the pediatric population. So we can keep that in the back of our minds to try to alleviate some of that fear that we have, that our kids, let's say they do get COVID during the fall season or during the winter time, when this virus is supposed to be a lot more active. They hopefully will fight it off by themselves and not run into any complications. Now, that is one part of the situation. The other thing is, if the vaccines do get approved by then, and we hope that by late fall, that the vaccines will be available for the kids, the younger kids, that we should go ahead and vaccinate them as quickly as possible so that they are protected. And I think a combination of these two thought processes should make it much easier for the parents to send their kids back to school so that they can have as normal a life as they're looking forward to.
Right. But doctor, my question to you, and that was a part of that too, should they be wearing masks then? Because, masks has now become this political issue, social issue. It's, gone beyond the science that was behind it. But I think that, this is all about making sure everyone's safe and, secure. How are you looking at masks in schools?
So if you look at a lot of different viral illnesses that are there, they do get transmitted through the air droplets. And having a mask on is going to protect you not just from COVID, but from many other illnesses. So as a parent that is looking out for the welfare of your child, it would be something that I would recommend for parents to go ahead and impress upon their kids. The other things are common precautions of maintaining social distancing, maintaining good hand washing, making sure sanitizing yourself. And if you think back, even before the pandemic came around, whenever you would have a cold or whenever you would have any other viral illness that was being circulated, we would always tell everybody to keep your distance, right? So how is this any different? And how is this any, it has become such a big political issue. But this is just common sense precautions that we would have taken anyway with any other viral illness. So why not be a little bit more vigilant and be more protective with the COVID that's there in the air at this point? So I would be a proponent for wearing masks, making sure you keep your social distance, and try to be as normal as you can with those protections in place.
Doctor, this brings me to another question. What's the worst case scenario here when you're looking at children? What's the most dangerous scenario if these, vaccines are not given to children, if the parents decide to not vaccinate their child?
And that is also a fear, because there are some quote unquote what we call anti-vaxxers,
right,
who just don't believe in vaccines, or who are very scared of vaccines, or believe that the vaccines are not needed and that your natural immune system should fight off these illnesses. So that is one train of thought that a certain group of people have, but not something that I would want to go ahead and push forward. Why not protect your child when there is something that can potentially protect them? And as you asked about the worst case scenario, the worst case scenario is death. Is that something that you want to risk? Many parents, when they're anti-vaxxers, come up and say, well, why are these vaccines around? We don't see polio, or we don't see meningitis. Why should we give that to our kids? And what I tell them is, 25, 30 years ago, when I was training and some of these vaccines were not around, I was seeing those kids in the hospital. Okay, so if you give any of these other childhood vaccines, the normal childhood vaccines like rotavirus, or the flu vaccine or the meningitis vaccine, these are some of the more deadly illnesses that are there. And with the advent of the vaccines, these kids are getting healthier and avoiding those illnesses. Similarly, you have the COVID vaccine that's there to protect your child. And as you've already seen, more than millions and millions and millions of people have been affected with COVID. How many have died from COVID? How many families have been affected? So why not take something that is going to protect you, your family, and everyone around you? Just talk to one family who's lost a dear one, and I think it'll make it very, very real. So, yes, vaccine hesitancy is there, but look at the science behind it, and just don't do it by hearsay, but try to go ahead and prove it yourself.
Yeah, it's so important to get that vaccine when it's available to you. We've seen such a destruction in the world through this. How are you, doctor, looking at Delta variant of coronavirus right now? It's spreading all across the nation. Dr. Anthony Fauci just today said that it is a variant of concern and a great concern for unvaccinated people. So now we have these children who are also unvaccinated. How do we handle this, and how are you looking at this variant?
So putting it all together, I think, obviously everybody's aware of this Delta variant, especially since we are from the country where it has originated from. And as we know that these viruses do mutate and different variants come out, what we also know is that the vaccines that are there right now that have been given to us have a protective effect against the Delta variant. So that is why there is a rush to go ahead and vaccinate as many people as possible. And especially the US is taking the lead on this, trying to go ahead and vaccinate the rest of the world. through these vaccines that can protect them against a lot of these variants that are coming up. So now bringing it back home with the kids that are not vaccinated, keeping our masks on, keeping that social distancing, making sure you use common hygiene precautions are going to protect you until that vaccine gets available for the kids.
Right, so important again to get vaccinated. You know, we keep on pushing that. I have 2 more questions left for you. How are you looking at summer camps, parks, theme parks? Everything is opened now. Again, my question to you is, how should these parents protect their children? Do you recommend people attending crowded areas such as a summer camp, or going to the park, or going to theme parks? How are you looking at that?
Once again, I think if they can avoid really crowded spaces, please go ahead and do that. If you can go ahead and maintain your social distancing, maintain your masking, maintain your hygiene, I think you'll be fine. We do know that a lot of these outdoor activities are great for everyone. Even when the pandemic was at its peak, we were going ahead and encouraging people and families to be outside. So if they're partaking in outdoor activities, hey, go ahead and enjoy it. Now's the time. The summer is a great time to be out. And one of the other things that we've seen during the pandemic is the absolute rise in obesity in kids, right? So being out, being physically active is going to help you curtail some of those negative impacts of the pandemic.
Yes.
And once again, and I think we've said it repeatedly throughout this whole segment, is hygiene, sanitary precautions, masking, and social distancing, and you should be okay.
And my final question to you, doctor, is I'd like to know a prediction from you on what's going to happen with children and vaccine in the next coming months. What is your prediction for the fall especially?
So the hope is that the vaccine will be out by the fall, that our younger age group will be getting the vaccines towards the end of the fall, and that we hopefully will have a nice winter where people can try to get as normal as possible by next spring. And hopefully this will just be a page in the history, and we can move forward in a positive direction.